Hi, this is Dr. Leslie Manson.
I'm Dr. Mark Rudy.
I'm Dr. Freitas.
This is Dr. Nick.
Dr. Kerr.
Just wanted to let you know that if you need us, we're still here.
Estamos aquí.
We're still here.
We're still here.
We're still here for you.
We mental health providers of Arizona wanted to extend our warm support and these brief educational videos to reduce stress and navigate challenges. If you need help, please reach out. We're still here for you.
My name is Dr. Nick Arndt. I'm a psychiatrist in training, and joining me today, it's my pleasure to introduce Dr. Klinger, one of the outstanding child psychiatrists in my department.
Hey guys, good afternoon.
Dr. Klinger, can you just say a little bit about yourself and maybe how long you've been doing the child psychiatry? Or
Sure, yeah. So I guess I did adult residency from 2006 to 2010. Then I worked a little bit in adult psychiatry, inpatient attending for a bit, and then I did 2 years of child fellowship. Both of those were in Boston, first at the Cambridge Health Alliance and then Mass General McLean. And then I spent about 3 years on an inpatient child and adolescent unit, working inpatient psychiatry as well. And then late 2015, early 2016, moved to Tucson, Arizona to join the Department of Psychiatry here. And I've been doing outpatient psychiatry, do a range of things across Tucson right now. And I can talk more about that later.
Okay. Well, I am so happy that you came over to Arizona to join us in the sunshine here. Moving on to our topic, it sounds like today we were hoping to talk a little bit about disagreements within the family when it comes to coronavirus and how to navigate that, especially when there's kids at home that make things even more complex.
Yeah, I hear a lot of families talking about this as being like a big challenge for them. And I think all of us may be experiencing a little bit of this on our own as well.
Mm-hmm. And were there things that you were hoping to get across to them, or that kind of messages as far as trying to navigate that?
Yeah, I think some things that I've been learning myself, and then some things that I've been finding myself talking with a lot of families who seem to be sort of resonating with this in terms of how to kind of navigate the way through.
What has been helpful for patients or for families?
Yeah, I think what I've noticed was that coming into this whole kind of stay at home kind of everything slowing down and shutting down, and asking people to not do some of their favorite activities and their typical routines, it's been a huge challenge. And I think what we found is that a lot of couples, within the couple, they differ, about, who feels like, safety is more important in terms of like making sure you're not being exposed to everything, versus others in the couple who may be more focused on like, hey, these are the things I need to do. I think you're maybe going overboard with that much safety precautions and that type of thing. And, whether it's going to the grocery store or just being out on the bike path, there's a different perception of risk, but, how do you come to some common agreement and understand where the other person's coming from?
So it's kind of sounding like you do encourage families or parents to find a united front or a common ground, so the message is clear. Or
exactly, yeah, that's what I found myself doing a lot of the time.
Okay.
And oftentimes we find out that when you've got something going on that causes fear, of course it kind of like right away raises up everybody's like that kind of fight or flight kind of response. And typically when we're in that mode, we can kind of go into that kind of all or nothing type of thinking about things. And once we're in that mode, we start saying and doing things that really kind of make the other person feel like we can't see their side, or like it's really hard to be compassionate when we're in that fight or flight mode. And that can often lead conversations really, really far off the rails.
And I can just kind of imagine that you're in the room and this is playing out in front of you. How do you help families or parents to manage that or to come together?
and really one main approach is giving each person the time to kind of express what they're going through, and sort of express where they're coming from, and really try to key in on the core of what's valid and universal about what they're saying or the position that they're coming from. And that often is a big factor in helping people to kind of calm down out of that fight or flight response. When you can really find in there the core of what they're saying is a universal need. So example, the person who may want to go out on the bike ride and, you know, get that fresh air and just be able to kind of experience some of the outdoor space, but then may feel a little uncomfortable with like putting the mask on, right? Isn't so sure about that that's a signal that they want to be giving off or whatnot, because they're more focused on that kind of that freedom, that kind of autonomy, which is a universal need that we all have. And you kind of don't want anybody telling you what to do, for example. And, you know, and so that can lead to like a lot of behavior that sort of minimizes what the other person is trying to bring to the conversation in terms of like, you know, just having like a core standard that's agreed upon about the safety of the issue.
Yeah.
So,
yeah. I mean, something that I think a lot of people are challenged by is that if there is, you know, someone that's, I don't know, misbehaving comes to mind, but just acting in a different way, you know, as far as wearing the mask less often or maybe not as good at the social distancing, that kind of will almost open a door into the household that they could be the person that exposes other people. I know I'm not one to start playing the blame or the guilt card, but I think that's a little bit of the realities that we're facing.
Yeah, it's true. Yeah, and I think that whenever people are feeling like their needs are being encroached, we tend to like reflexively look at the other person who might be to blame for why our needs aren't being met, or some of the restrictions on our needs being met. And I think it's very easy for that blame game to get going. And once that's going, there's no compassion for like really what's at the core of what the other person's really needing in that situation.
So maybe once the blame game is going, better to slow down and understand the other person's needs. Or
yeah, that's the goal, and how to kind of help people to signal each other, whether it's within a couple or with a parent and child, that okay, wait, let's maybe take a time out, and maybe both kind of like retreat back into our corner and reflect on what we're really trying to do, rather than sort of saying, well, you need to do it. You need to reflect on what's going on for you, you know, because that tends to convey a message that you're the person who needs to change or you've got it wrong. So how can we say, hey, wait, let's take a step back and both consider what's really going on for us. And sometimes that can be a signal like pulling on the earlobe, or like something that can make you smile and laugh when you want to kind of trigger, you know, let the other person know that you, that both sides need to kind of take a step back and reflect on what's really going on.
Maybe take a time out for at least a few minutes, or
yeah, sometimes that language is useful for people as well. Yeah.
Well, you know, now the rubber is meeting the road. It's the end of April and things are about to reopen. Any advice or tips for, I feel like it's going to be a lot of challenging conversations ahead for people.
Yeah, I mean, I think getting ahead of it is, you know, kind of a low-hanging fruit kind of way to think about it, and then try to have the conversations even before the governor changes the executive orders and stuff like that. So, you know, maybe making a time when everybody's in a relatively low stress situation, possibly on a weekend or, you know, whatnot, or while doing something else that you enjoy before and after the hard conversation, kind of maybe plan it in that way, like do something fun, talk about the hard thing, and then maybe going back to some more fun afterwards to talk about like, what's it going to be like when there's the feeling like, okay, you know, we could go back to the way things were. And that's actually not the way it's going to be, right? I think the whole notion of a safe opening up is that it's going to be in phases, and that we're probably going to have to maintain some of our behaviors. And so, you know, being able to like talk about what that means, or like give people a chance to say, well, this is the way I'd like it to be.
Yeah.
So you can really kind of get that open in the open. And then when you realize that actually even the people who are more on the safety side, as opposed to the like freedom and autonomy side, even the safety people actually want things to be opened up and having more free too. So giving a chance for all sides to talk about how you wish it would be, and then think about together how you can take some steps and make sure that the steps you're taking, are progressing, and that the data from the scientists, and the medical doctors kind of back up, that things are improving.
Mm-hmm. Well, as you kind of open this up, I feel like there's an uneasy feeling in my gut too, just thinking about how unknown it all is and what is life going to be like when things reopen. So in some ways we're kind of left taking it a step at a time.
Yeah, I think I think it's one of the things that I found humbling, even like, as a doc, and, like my expertise doesn't serve me well in this situation per se. Even as like as a physician, healthcare professional, there's so much that we haven't known about this, and there's so much that we're trying to making choices for the community as opposed to ourselves, which isn't always a very familiar thing to do. So I think we're all kind of skating on thin ice, and just I think give each other credit that we're all going to be a little stressed out again, just like I think we were before we settled into this new normal.
Mm-hmm. Well, thank you so much for taking the time to speak with me today. And for all of our listeners out there, just want to let you know that we're here to support you if you need us. So
yeah, we're here.
Please reach out to your healthcare providers if needed. All right. Thank you, Dr. Klinger.
Okay. Thanks, Nick. Appreciate it.
Bye now.
Bye.
Just wanted to let you know that if you need us, we're still here.
Estamos aquí.
We're still here.
We're still here.
We're still here for you.
If you need help, please reach out. We're still here for you.